you have a fascinating journey, and I'd love to unpack that a bit. So doctor to intrapreneur to entrepreneur, then medical officer to startup advisor, now looking at investing roles. Um, what inspired you along that journey, moving from one role to the other, and what did you do in those roles?
Yeah, no, I think that's a great question. And I think as I was thinking about this, it's not really discreetly moving from one thing to the other. It's kind of a continuum, just kind of a blend as I go through my journey. I'm starting to morph and evolve into different things as I pass through, and I don't completely leave anything behind. I just kind of like add it to the evolution of the things that I'm doing. And so I think, I think the thing that's really inspired me to kind of jump in and do all this work was that I really thought of myself as a problem solver. And initially as a clinician, as a physician, I wanted to like fix hard problems. And I would look at things that were not working in our system, and they were driving human error, and it was the only solution was someone just had to work harder and faster, and they could never
Hmm.
be tired. They can never be subject to like the stressors of the environment. And I was like, wow, this needs a systemic thing, a systemic
Right.
change, a protocol, a way that we all do things together. Some of that involves technology and some of it doesn't. And so eventually at one point I was trying to solve different problems with the EMR, and helping work on asthma care or sepsis, in pediatric patients. And then one day, I happened to be a transport physician. So we would go help transport sick kids from an outside
Okay.
ER where they didn't have pediatric services to a pediatric ICU within the Kaiser system that had more services for really, really sick kids. And there was basically no situational awareness in the ambulance. They did everything on paper,
Hmm.
and the rest of our ecosystem worked in a digital world. So I said, it can't be that hard to create to make the ambulance part of the ecosystem. And so I basically went and worked hard and got a grant and, learned how to pitch and
Right.
got money and helped design a system to put the EMR in ambulances so that our teams that were taking care of the sickest patients in a box traveling 70 miles an hour, in the middle of nowhere in California, could have access to the tools of the electronic medical record, or know what someone's drug allergies were, or know how to dose medications. Could see the information that was happening, and then people could look into their ambulance and see what was going on. And you could, when you were on your way to pick up a sick kid, you could know what was happening in that other
Right.
Kaiser ER, and react. And in that whole journey, and getting that operationalized, that was like my first intrapreneurial startup, and that word means basically I'm doing
Hmm.
entrepreneur like activities, but I'm working in a company. I haven't left. But I had to pitch it. I had to build stakeholders. I had to engage everyone. I had to get the grant funding. I had to sit down with the engineers. I don't code, so I sat with them in our corporate offices, basically programming the different tools, went back to the nurses and staff and figured out how to design it right using human-centered
Right.
design principles. And I rode in those ambulances too, and I worked with them. And I knew if I created a product that didn't help them take better care of kids,
Hmm.
that I was failing, right? And so um, under those basics of that journey really inspired me to want to do it forever. And I knew at some point, I think it was in 2012, that I wanted to do this at some
Hmm.
point, I wanted to become a person that did digital health. And I didn't know how
Right.
I would get
Right.
there, but I was like, I got to do this.